about why the process items at all. First of all, it's important to know that home health as a setting is a little different than other healthcare settings. Now, all of us in home health already know that, but in fact, when we started doing quality measures, we started at the high level. That is, we started with outcome measures, whereas most other healthcare settings started with structure items first and then went into process items. Home health has never really used process items in the quality measures, at least until this point. And that is part of why these process measures are being introduced at this point. CMS believes that home health needs certain process items for a number of reasons. So talking about that, if you look at your slide number 2, we're beginning to talk about why CMS added the process items. Process items promote the use of evidence-based practice related to common clinical conditions. It is a long-standing federal objective that a standard patient assessment instrument that can be used across all post-acute settings will be developed, and as many of you know, that is being tested currently and is in the development area. So many of these process items are seen in other settings, and they're also going to be incorporated into our specific OASIS so that when we go to that one post-acute assessment tool, we'll already be familiar with some of the process items. That means that it'll align the OASIS with other provider instruments that are out there. It also, the process items provide an opportunity to include various components of quality care and how patients might be better served as they move across the continuum of healthcare settings. Process items that measure evidence-based practice have been shown certainly to prevent exacerbation of serious conditions, to improve care received by individual patients, and to provide guidance to agencies related to improving care and avoiding adverse events. Basically what that boils down to is a greater consistency across the healthcare continuum and also standardization amongst the industry. Most of us know that a lot of these process items are basically good practice, but by putting them into the document, we now have a way that they are standardized across all agencies. So if we look specifically at some of the benefits of the process measures to different groups, starting on slide number 3, we see that for home health agencies, this patient-specific information helps with care planning, quality assessment, and program improvements. It will allow assessments of a degree of implementing the best practices related to the assessment, proactive care, planning for patients with common conditions like diabetes and heart failure, patients at risk for falls, depression, and pressure ulcers, amongst other things. So what it does is be able to provide that baseline and allow us as individual agencies to also improve our quality improvement. From the perspective of the state agencies and CMS, the process measures allow selected areas to be targeted for on-site survey area activities. That may allow the surveyors to measure frequency of home health agency use of certain processes of care that are recognized as optimal practice. And remember that the number one goal of CMS is to reduce the cost of health care and to decrease acute care hospitalization. So if these processes, which all of them do contribute in to helping to reduce that additional cost, are successful, it will be a success all the way around. So that means the state agencies, when they come out for surveys, would be able to see how the agency is using these opportunities to identify opportunities for their own improvement to improve the quality of services going to their patients. Additional folks that have benefits from having these process items, the accrediting bodies. Most of our accrediting bodies from national perspective have included many process items in their standards, and they've already implemented them in the accreditation process. By aligning that with what we're